Have you ever stopped to think that your kidneys might be crying for help without you even realizing it? Most people believe they only need to worry about these organs when there is severe pain or when test results show abnormalities. But the truth is, the kidneys are masters at suffering in silence. And precisely because of that, millions of people worldwide live with chronic kidney disease without even imagining it. Studies show that up to 9 out of 10 people affected don't know they are sick. This is alarming, because when detected early, there is still a real chance of preventing the disease from progressing and destroying quality of life. The kidneys are not just the body's filters. They act as health control centers. In addition to eliminating toxins through urine, they regulate salt balance, keep blood acidity at proper levels, play a role in producing hormones that regulate blood pressure, stimulate the production of red blood cells, and even help protect bone health. If they collapse, practically the entire body suffers. But how can you recognize, in everyday life, that something is going wrong? 1. Sudden swelling in legs and eyes. Picture this: you wake up, look in the mirror, and notice puffiness around your eyes. Or at the end of the day, you remove your shoes and see marks left on your feet, as if the socks had sunk into the skin. This fluid buildup may be directly linked to the loss of albumin. Without this protein in the blood, water leaks into the tissues and causes swelling, especially where gravity facilitates accumulation, such as the ankles. In more severe cases, fluid may even accumulate in the lungs, causing shortness of breath. Of course, leg swelling can have other causes, such as varicose veins or standing for long periods. But if the problem is frequent, worsens over time, or appears in unusual areas like around the eyes, the kidneys should be on the list of suspects. 2. Persistent foamy urine. It's common to see a few bubbles in the toilet after urinating. That happens when the stream is strong or when it reacts with cleaning products. But there's a clear difference between temporary bubbles and a thick, white, persistent foam. This foam doesn't disappear quickly and looks much like the head on a glass of beer. This may be a sign of protein loss in the urine. When the kidney filters, called glomeruli, start to fail, they allow albumin molecules to escape. When this protein comes into contact with water, it creates foam. The problem is, the body depends on it to keep fluids inside blood vessels. If it's leaking out, something is not working as it should. 3. Waking up several times at night to urinate. There's a common myth: peeing a lot means healthy kidneys. Not always. One of the first signs of kidney failure is the inability to concentrate urine. Normally, the body reduces urine production at night so we can sleep uninterrupted. This happens thanks to a hormone called ADH. But when the kidneys are overloaded, they lose this ability, and a person starts waking up 2, 3, or even more times to use the bathroom. This habit, known as nocturia, deserves attention, especially if it develops suddenly and isn't related to excessive fluid intake before bedtime. 4. Changes in the nails. The signs are not only in urine or swelling. Your nails may also reveal a problem. Some patients with chronic kidney disease develop a pattern called half-and-half nails. Half of the nail, usually the part near the cuticle, turns whitish. The other half, toward the tip, becomes reddish or brownish. The exact cause isn't fully understood, but the link with kidney dysfunction is clear. It's not an exclusive sign, but when combined with other symptoms, it becomes an important clue. 5. Small white lumps under the skin. Another warning sign comes from excess phosphorus in the blood. Normally, the kidneys eliminate excess of this mineral. But when they can't, it binds with calcium and forms crystals. These crystals may deposit under the skin, creating hard, whitish nodules that resemble grains of sand. In some cases, these nodules may even rupture and release a thick, toothpaste-like material. Although they usually aren't painful, they signal that the kidneys are failing to regulate minerals in the body. The greatest risk comes when these deposits form inside arteries, hardening blood vessels and impairing circulation. 6. Frequent cramps. Who hasn't woken up in the middle of the night with a painful calf cramp? The problem is when this becomes constant, with no apparent reason, even in people who don't engage in intense physical activity. Cramps may be linked to imbalances in calcium, magnesium, or even acid buildup in the blood, all common when the kidneys begin to fail. They are also a reflection of the body losing its ability to maintain the chemical balance required for proper muscle function. If you experience repeated cramps, especially at night, it's important to investigate kidney health. 7. Fragile bones and loss of height. Few people know that kidneys play a key role in bone health. When they fail to properly activate vitamin D, calcium levels in the blood drop. To compensate, the body begins to pull calcium from the bones, weakening them over time. This process leads to osteoporosis. Patients may report fractures after minor falls, back pain, and, in some cases, even a reduction in height. When someone says they've shrunk a few centimeters with age, it may actually be the result of silent, progressive vertebral fractures. This should not be ignored. 8. Unexplained itching. Itching may seem trivial, but when it's intense, widespread, and worse at night, it can be a sign of toxin buildup in the blood, a condition called uremia. These substances irritate nerve endings and, in some cases, directly affect the brain, making the sensation almost uncontrollable. Some patients even injure their own skin from scratching before being diagnosed with kidney disease. If the itching doesn't improve with moisturizers or simple creams, it's time to investigate further. 9. Restless legs. At night you lie down to rest, but feel an irresistible urge to move your legs, as if something is bothering from inside. This condition is known as restless leg syndrome. It may be related to low iron in the brain, an indirect consequence of kidney dysfunction. That's because accumulated toxins alter the way the body distributes iron, impairing dopamine production, a neurotransmitter essential for movement control. The result is insomnia, fatigue, and poor quality sleep. 10. Changes in taste and breath. A curious but revealing detail. Many people with kidney disease describe a metallic taste in food, as if they were chewing on coins. This taste comes from the buildup of urea in the blood, which eventually reaches the saliva. The same substance can also cause breath that smells like ammonia or even urine. This sign is called uremic breath. It's not only unpleasant but also an indication that the kidneys are already in advanced distress. These signs may seem like small everyday details: foamy urine, swollen ankles, nail changes, itching, or cramps. But when considered together, they may represent an early stage of chronic kidney disease. The biggest danger is ignoring them, because the disease often progresses silently until it reaches stages where recovery becomes much more difficult. In the next block, we'll go even deeper. You'll discover the late-stage symptoms, the hidden risks, and, most importantly, what steps you can take to protect your kidneys and prevent them from collapsing. When the kidneys collapse. In the first block, we saw how kidneys give off subtle, almost invisible signs, like foamy urine, mild swelling, or nail changes. But when the disease progresses, the body can no longer hide its suffering. It's as if the entire organism begins to scream for help, and those screams often come in the form of intense, painful, and sometimes dangerous symptoms. Recognizing these signs can mean the difference between beginning an effective treatment in time or facing a desperate race for survival. 11. Loss of appetite, nausea, and vomiting. Imagine sitting down to enjoy your favorite meal. The smell that once brought pleasure now makes you recoil. Eating becomes a struggle. This is a classic symptom of toxin buildup in the blood when the kidneys can no longer filter properly. The brain, which has protective sensors to detect spoiled food, gets tricked by the waste products floating in the bloodstream. The result? Loss of appetite, frequent nausea, and unexpected vomiting. This leads to involuntary weight loss, progressive weakness, and the risk of malnutrition. It's not just uncomfortable, it's a sign that your body is literally poisoning itself from within. 12. Easy bruising and bleeding. A simple bump, something most people wouldn't even notice, becomes a large purple bruise. Brushing your teeth turns into a frightening scene, with blood dripping from the gums. Small cuts take much longer to stop bleeding. This happens because toxins interfere with the job of platelets, the blood cells responsible for clotting. The body loses its natural glue against bleeding, leaving the person vulnerable to constant bruising and hemorrhages. This isn't just a cosmetic issue. It's dangerous because it also raises the risk of internal bleeding, often invisible until it becomes life-threatening. 13. White powder on the skin, uremic frost. One of the most shocking signs of advanced kidney failure is what doctors call uremic frost. When blood is saturated with urea, the body tries to get rid of the excess through sweat. As it evaporates, it leaves behind a white, salt-like powder on the skin. This frost can appear on the face, neck, and arms, and while it causes discomfort and embarrassment, its real meaning is devastating. The kidneys have nearly stopped working altogether. 14. Chest pain caused by inflammation. The kidneys and the heart are deeply connected. When the kidneys fail, toxins accumulate and can inflame the pericardium, the membrane surrounding the heart. This inflammation, called pericarditis, causes strong, constant chest pain that worsens when breathing deeply or lying down. Many patients rush to the ER thinking they are having a heart attack, but the cause is kidney failure. In severe cases, fluid builds up around the heart, restricting its ability to beat and putting life at immediate risk. 15. Extreme fatigue and weakness. This exhaustion isn't just physical, it's total. Climbing a few stairs feels like a marathon. Simple household chores, like sweeping or carrying grocery bags, become overwhelming. This happens because the kidneys also produce a hormone called erythropoietin, which stimulates the bone marrow to make red blood cells. Without it, anemia sets in, and the blood loses its ability to carry oxygen. The result is extreme fatigue, shortness of breath, and an unrelenting sense of weakness. This is one of the most reported symptoms among chronic kidney disease patients, but it's often mistaken for stress, aging, or depression, delaying proper diagnosis. 16. Nervous system changes when the kidneys stop filtering properly. Toxins affect not just the body but also the brain. Patients report mental confusion, memory lapses, poor concentration, and mood swings. Some become irritable, others experience tremors, excessive drowsiness, or even seizures. It's as if the brain is trapped in a toxic fog, unable to function clearly. These neurological issues are a red flag that the body is already dangerously overloaded with waste. 17. The complete absence of symptoms. Ironically, the most dangerous sign may be no sign at all. Many people live with advanced kidney disease without swelling, pain, or noticeable changes. They only discover it during routine tests, often when the kidneys are already severely damaged. That's why regular checkups are critical, especially for those with risk factors like diabetes, high blood pressure, a family history of kidney disease, or frequent use of anti-inflammatory drugs. When kidney failure reaches the limit if left uncontrolled, kidney disease progresses until the kidneys nearly stop working. At this stage, called end-stage renal failure, survival depends on dialysis or a transplant. Dialysis, a life-saving treatment, but one that completely changes daily life. Several times a week, patients must spend hours connected to a machine that does what their kidneys no longer can. Diets become restrictive, fluids are tightly controlled, and freedom is replaced by a schedule dictated by treatment. Transplant offers a chance at true recovery and quality of life, but it depends on finding a compatible donor and requires lifelong medications and medical monitoring. This is where the importance of early diagnosis becomes clear. The sooner kidney disease is identified, the greater the chance of preserving kidney function and avoiding this extreme outcome. What you can do to protect your kidneys. The good news is, there are simple but powerful steps to prevent kidney disease or stop it from getting worse. 1. Control blood sugar. Diabetes is the leading cause of kidney failure worldwide. Keeping blood sugar under control is essential. 2. Monitor blood pressure. Silent hypertension slowly destroys kidney blood vessels. Checking blood pressure regularly is a must. 3. To be cautious with painkillers. Common drugs like ibuprofen and naproxen, when misused, can irreversibly damage the kidneys. 4. Balanced hydration. Drinking enough water helps, but drinking too much can be just as harmful. The right amount depends on lifestyle, climate, and individual needs. 5. Regular tests. Simple blood and urine tests can detect problems years before symptoms appear, giving you the best chance to act early. Your choice now can save your kidneys. The kidneys rarely cry out for help in dramatic ways. They whisper. Foamy urine, swollen ankles, nighttime cramps, loss of appetite, a metallic taste in the mouth, signs that most people dismiss as stress, aging, or just part of life. But each one of these could be the first warning that something serious is coming. Ignoring these whispers is opening the door for kidney disease to progress until it's too late. Listening to them is an opportunity to act in time, preserve health, and avoid the dependence on a machine or the long wait for a transplant. If you've noticed any of these symptoms in yourself or someone close to you, don't delay. See a doctor, get simple tests, and learn the truth about your kidney health. And if this message resonated with you, share it. You might be saving someone's life without even knowing it. Leave your comment. And don't forget to subscribe to the channel for upcoming content on health, longevity, and body transformation. Support our channel. Check the first pinned comment below to learn how.